So welcome to the JDA Leadership Dialogues. This is the first time to have this JDA dialogue in person. And we are really lucky to have a Professor Terry Cronin, President of AAD. And thank you very much for joining us for today. Please introduce yourself to the JDA audience.
Well, let me say what an honor and privilege it is to be here. And to be the first in-person interview is really an honor and exciting, and I think an improvement. I've been on many Zoom calls since the COVID pandemic, and I'm tired of Zoom calls. I like to meet people and meet them in person, so this is a real honor. I'm Terry Cronin. I'm the American Academy of Dermatology President for 2023 to 2024. I think that some of the things you might find interesting is my father was a dermatologist. And I followed in his footsteps. I didn't plan to, but when I went to medical school, I tried to keep an open mind. But nothing compared to dermatology. You know, and you know what I'm saying. You look at all the different specialties of medicine, all the different disciplines, and really dermatology spoke to me in a way that's quite different. And I think it has to do with visual learning. I grew up reading comic books when I was little. I devoured comic books and always read with the pictures, and I loved movies, and I became very interested in movies. And I think that visual learning played well into becoming a dermatologist, because when I was a kid, I could look at a comic book and say, I know who drew that. I could tell you the artist that drew it. And so that kind of leads into the study of detail and noticing things with vision. So I like the idea that we could look at the skin and make diagnoses and help the patients. And I became interested in dermatology, and I was lucky enough to train at the University of Miami, Department of Dermatology, where my chairman was Dr. Bill Eaglestein, a fantastic gentleman who really was like a father figure to his resident. I'm in private practice now in Melbourne, Florida with my father, and I also have had my niece join me, who also is a dermatologist. So it's a family legacy.
So 2 questions.
Yes.
You like the comic book when
Yes.
you were young. Some of those comic books include Japanese one or American, like Superman or...
I was a fan of Akira. When I was a kid, that movie, it came out as a movie. And from there, I began to read that, and I read also what we call Lone Wolf and Cub. I don't know what we call it in Japan. Lone Wolf and Cub was a translation of a samurai who has a baby, that he takes care of a baby.
Yes.
Yes, very popular in the United States.
I see. It's really a light story. Yeah.
Yeah, I think people who enjoy comic books, who enjoy films, gravitate toward dermatology.
Wow.
Right?
Wow.
And they may also gravitate toward radiology and pathology, you know, because those are the visual specialties. But we get to look at patients visually. We're not looking at scans or microscopic slides. That's just a theory of mine.
Not only you as a prominent, talented dermatologist and surgeon, you are also a novelist and writer.
Oh, yes.
So it was really surprising to find that you have a couple of published novels. So could you tell us about that part of it?
One of the things I like to talk about is the use of creative writing to combat burnout, because doctors get burnt out. We're seeing a rise of burnout. There's a global figure of 64% of doctors in the world are suffering from burnout. There's too much work, too much administrative aggravation, and they're losing the joy of being a doctor. And I find that with creative writing, you can build some joy in your life because you're using a different part of yourself. You're using a different energy than the one you use day to day in working. And I'm sure in the laboratory you have creative energies that are different than the energies you get when you see patients. So I think you may find that might prevent burnout working in the laboratory. But creative writing is something that I think is being utilized by psychologists and psychiatrists as a way for people to deal with depression and post-traumatic stress disorder.
So what type of surgery, dermal surgery do you do? Or
I focus on myself mostly on skin cancer surgery, like Mohs surgery for skin cancer, melanoma. Anytime somebody has a skin cancer, patients are referred to me or they come to me because they think they have a skin cancer. So I do a lot of surveillance. I do a lot of skin cancer operations. These are operations that probably in the 50s no dermatologist was doing. But now almost every dermatologist is doing skin cancer surgery.
So could you tell us more about the Mohs surgery? Because the Mohs surgery is not available in Japan. So could you explain
Sure.
the Mohs surgery?
So Dr. Mohs was a surgeon who practiced in Madison, Wisconsin. And he had this idea that he would use zinc chloride paste on the cancer, and then he would cut it out in stages. He would actually fix the cancer, and then he would cut it out and look at all the margins in a way that it would see the complete margin. And so pathologists would typically, when they would look at a specimen, they would take out the specimen and cut it like a bread loaf. And they would look at representative specimens, right? Well, you could miss things because of how much room you put between each slice of bread. Well, Dr. Mohs instead peels it like an orange peel off the entire margin of the specimen. And he would look at that under the microscope. So his real innovation was how he looked at the pathology. I often think that Mohs surgery should really be called Mohs pathology and surgery because his pathology was the real thing that changed how we look at it. It was in the 70s that Drs. Tromovich and Stegman began doing it on frozen sections rather than fixed with zinc chloride paste. And that was the big moment when things changed. When they realized you could do this on a frozen section, that you could do it fairly quickly. Where Dr. Mohs, what he would do is he would put the zinc chloride paste on you and then send you home, bring you back the next day, cut a little piece out, then send you home and cut a little bit more out. It was a time-intensive process. With the frozen section margin, it became less time-intensive. So that it could be done very quickly in the lab. And the dermatologist works as the surgeon and the pathologist during Mohs surgery. So the dermatologist is looking at it under the microscope while the patient is waiting. And once the cancer has been completely removed, then the dermatologist repairs the wound. That's where reconstruction comes into place. You know, your system's so interesting to me is that Kenji was telling me that many times the people you train stay with you forever. They're part of your hospital system. And I thought that was a little different than what we do because our training programs usually train them and send them out, but often send them out to other universities. If you're going to stay in academia, you go to another university and it, like cross-pollinate and bring different ideas to different universities. Kenji was saying that very often they keep their own. Is that the same here?
Yes, that is one of the very unique Japanese tradition. It's kind of inbred system. The majority of people, they stay in a single medical institute. But this is in contrast with the German system. The German system, if you graduate from a university, you can never become the staff people of a university. That is a general rule. I think that system is really good to mix up people. But the somewhat Japanese people, this is not only in medicine, but many. But now it's gradually changing.
There seems to be cross-pollination between the departments. How are you able to achieve that?
For example, people who are interested in research, we can easily do that. If they have some special technique, we can easily send our fellow to them.
I see.
But for the medical professions, it's not easy. Another thing is that we have a mind to really mix up people. I'm talking with Kenji and Manabu a lot. But now, for example, last 10 years, 90% of the new resident is the female. So they have their family, and it's not easy for them to become a different place and to do training. So that is another issue. In US, you may have a similar issue about many doctors are female, and also they may have some families. But as a general rule, they stay there for the 3-year residency period, then move on to next step. So one of the advantages your system is that they can make a plan, probably. So anyway, please tell us that how people can keep moving around the different institute.
Well, you touched on several things.
Okay.
Right?
Okay.
Number one, yes, dermatology in the United States has become female dominated.
Yes.
So the majority of dermatologists, just even in practice now, has become female. But certainly all our trainees are majority female. Why that is, I don't think it's only dermatology. There's something going on with young men in America. They're not going to college as often. They're not going on into medical school like they did when it was my generation. Something seems amiss, and I'm not sure what it is. I don't know that anyone has their finger on it, but I've read a few articles, and there's conjecture of what's going on. But it does seem a little strange. But certainly, excellent dermatologists, very brilliant young women who are becoming dermatologists. You know, in the United States, and I'm sure in Japan, it's the most competitive field to get into. And the other thing you mentioned is that if they're trained, what do they do, where do they go? So what happens is a lot of people train, and either if they want to go into academia, they may stay at the university, or they may find that their chairman is friends with someone at another university and they have opportunities to move somewhere else. But our trainees end up going to places that are usually well populated with other dermatologists and metropolitan and fun places to live. You know, like there's a lot of dermatologists in New York City, in Washington, D.C., in Atlanta, you know, in Orlando, in Tampa. You know, in the big cities, people like to go there. But we're underrepresented in rural areas. So there's areas in our country where there's people who are working, farming in fields, who have tremendous skin cancer issues, but there aren't dermatologists nearby. So there's been a push to try to get some of our trainees to move to rural areas. One of the missions for me to be here is to build closer connection with the Japanese Dermatologic Association and to invite you to come to our meeting. We're having an annual meeting of the American Academy of Dermatology in San Diego, which is very close.
Yes, very close.
It's not that far away.
Just over Pacific Ocean.
That'll be in March, but I think it's much closer than our meetings in New York or Washington or other places. So it's an opportunity for us to get together. I would like to do something educational where we could bring maybe some minds together and do a symposium or something together, so that that we can show that there's a cross-pollination going on. That's my dream.
Oh, thank you very much.
Yeah.
Because the JDA also has a very strong desire and dream to be linked with AAD. This is really our pleasure to be able to talk with you on the possible future collaboration between AAD and JDA.
I think there's great opportunities,
Yeah.
and San Diego may be the great place. Well, I do want to say what an honor and privilege it is to talk to you today. I, myself, am very honored to be here. And on behalf of the American Academy of Dermatology, I thank you for this opportunity to speak with you today.
Thank you very much. Thank you very much, everybody. Thank you. Thank you.